Good morning, everyone. Welcome to a Day Without Childcare discussion and press conference. My name is Holly Wellborn. I am the Executive Director of the Children's Advocacy Alliance. We are the independent voice for Nevada's children, advancing systemic change in the areas of early childhood education, children's health, and child welfare. Quick housekeeping before we get into it. After my welcome, we'll hear from an awesome panel of experts. Then we'll move to question and answer portion of our event. You may ask questions via the Q&A function at the bottom of your screen. If you are a reporter, please indicate as such and indicate your news affiliate, and we'll be sure to get your questions answered. We also welcome questions from other participants. We appreciate you all for joining us for this eye-opening discussion about our nation and Nevada's childcare crisis and the policy solutions needed to improve access to quality, affordable childcare in our state. The COVID-19 pandemic cast a spotlight on the significant hurdles that families and early childhood educators encounter in providing quality childcare. It unveiled our childcare system as a flawed business model, marked by exorbitant costs for families and insufficient wages for workers. In Nevada, the cost of childcare surpasses that of in-state college tuition, while early childhood educators earn an average wage of $13 to $14 an hour. That's nearly 50% less than K through 12 teachers. The need for quality, affordable childcare has reached critical proportions. Nearly 75% of children ages 5 and younger do not have access to a licensed provider, which has damning effects on the Nevada economy. The American Rescue Plan Act made historic investments in the Child Care Development Block Grant, which supports childcare subsidy programs across the country, including here at home. These funds set up new programs, increased access for more families, and alleviated many workforce burdens. But these funds have expired, yet Congress has failed to act to restore funding to anywhere close to pandemic level investments. And Nevada invests zero dedicated dollars, general fund dollars, to childcare. A Day Without Childcare is a national movement of providers, families, and other advocates demanding crucial investments in childcare. Events like these are being held across the country, including in our nation's capital, where providers are advocating for a 21st century childcare system. And today, here in Nevada, we join their fight and call on our decision makers to act to create an equitable childcare system with thriving wages for childcare providers and affordable, accessible childcare for all families. I am so pleased to welcome our panelists. We have joining us Sarah Coonan, who is the founder and organizational director of Olive Academy, a premier center for early childhood education based in Reno. She is passionate about positive parenting and innovative quality education for young children. Also joining us is Jillian White. She is a licensed family friend and neighbor childcare provider, which is also known as a home-based provider. She has over 30 years of serving in numerous positions, from a licensed home provider to a center director in several states, including California, Virginia, Georgia, and right here at home. Her desire is to see all children, regardless of their family's financial means, have access to high-quality education starting at age 2. And last, but certainly not least, is Jamel Nance. Jamel is the Children's Advocacy Alliance's Early Childhood Policy Director. She leads our prenatal to 3 and early education initiatives. Welcome, everyone. Thank you so much for being here. It's so good to see you all. So let's get started. Let's go right into our questions. My first questions are for our providers. We know that you're busy. It's wonderful that you're here joining us today to tell the community more about what it is that you do on a daily basis. So let me pose it to you. Having your boots on the ground every day, what would a day without childcare look like, and how might families and professionals be impacted? Let's start with Jillian.
Good morning, everyone, and thank you again, Holly and Jamel, for inviting me to take part in this very important day. A day without childcare is a very serious situation. It's devastating. The impact is going to be felt throughout this entire country if we do not have efficient, effective, and affordable childcare. First off, I'm going to say whether you're home based or you're center based, it's going to be a significant challenge on all families where there's going to be work interruptions because parents are then going to have to find an alternative arrangement for their childcare needs. There's also going to be child supervision issues because some parents are going to be left with trying to just figure out like who's going to watch their children if they can't find someone outside of their home. There's also going to be missed opportunity for the children themselves to be socialized and also educational enrichment. There's going to be so much stress put on parents, put on the entire work economy. There's going to be a financial burden on the family and also on this economy, which we're dealing with that right now. Overall, I'm going to say that a day without childcare would disrupt the daily routine, it would strain the family dynamics, and it would potentially impact our children's well-being and development, which underscores the importance of accessible and reliable childcare.
Absolutely right. What about you, Sarah?
Good morning, everyone, and thanks for having me, Holly and Jamel. And Jillian. This is an exciting conversation to have, and I'm so glad that Nevada is at the forefront of this. I don't think we have to imagine it. Unfortunately, lots of the funding has ended. One of the things that I'm passionate about is the infant toddler subsidy pilot program that actually paid the true cost of care model, and that's going to be over September 30th. And on October 1st, families and children won't have to imagine that because they won't be able to afford the programs that they're in without that assistance. So I think this is an important conversation to have and to act on because we know how, as Jillian said, we know how important everything depends on quality childcare for our families and children.
Yeah. We're hearing every day about the anxieties that folks who are able to set up new programs, pay better wages, all of the things that both of you have been dealing with, fears of what that lack of funding is going to look like for the state. That's why this national push is so crucial for that national funding. So, Jamel, what about you? So on that point, what investments are needed to make accessible, affordable, quality childcare a reality here?
Thank you, Holly, for that question. I believe that there is certainly no one-size-fits-all plan, that no one entity should carry the cost of childcare alone. It has to be a collective effort that includes both federal and state level investments to ensure that we are meeting the needs of our children and families here in Nevada. In 2024, we know that there is an increase in the Child Care Development Block Grant, and this is a step in the right direction. However, we know that this will not be enough to sustain the progress that was made with the American Rescue Plan funds. There must be a state general fund investment in the Child Care Development Fund to improve wages and reimbursement rates and expand access to care. For example, just in New York, there is significant increase in the state general fund investment from the previous year. And this will expand their child care subsidy eligibility from 300% of the federal poverty level to 85% of the state median income. Likewise, in North Dakota, they are investing $66 million in the state funds to provide incentives to increase the supply of care for infants and toddlers. And so it will waive co-payments for families. This is huge, making it less than 30% of the state median income. And so lastly, in February, we know that the Biden administration announced new rules to reduce costs for families receiving child care subsidies. And so these rule changes will definitely provide positive impacts. It limits the amount that families would pay to 7% of their household income. And Holly shared earlier, the astronomical amount that cost our families. And this will make it easier to eliminate those co-payments that we know are huge for families, especially those with children with disabilities and other vulnerable circumstances. And so it expands the choices. So it is important for us to continue to spread this message to Congress as we're looking at ways to change those rules, those new rules that are coming down the pipeline, in addition to increasing payments to our providers. These are truly the type of investments that we need to see to make childcare more accessible and affordable to the families who need it most.
Yeah, there's been so much movement around the pandemic and that shift, really seeing how childcare and lack of access to childcare impacts our workforce and impacts our state. Nevada was one of the most impacted because of our tourism economy. So it really shifted the way that we see childcare from merely a family option to a public necessity. Providers struggle to keep their doors open to allow families to continue to work. So, Sarah, could you share what functioning in a pandemic looked like for you, and what were some of the barriers you faced?
It was very scary times for all of us, but especially for childcare. Um, I think the day that it hit me was we had a day where we were told that we had to close a classroom and send children home because there was a possibility that someone had COVID. And so we had to call parents in the middle of their workday to come pick up their children and bring them home. And one of the parents walked in and they said, I was just about to go into surgery. They were a surgeon. And I thought, oh my goodness, that domino effect that's having of this child is going home, the parents can't work, someone is in a critical health situation and they're not being cared for. So when that happened, that little interchange, I thought, wow, what we're doing is so important. Childcare workers, we're not just taking care of children, we're taking care of our community.
Absolutely. So, without a doubt, absolutely. And we've seen that. We've seen the change with the governor's office for workforce innovation taking a major interest in childcare and the way that it's impacting the state. You know, the business community is very invested in figuring out what those solutions are. Jillian, what was that period of time like for you as a home-based provider?
Well, a home-based provider, our situation is a very unique because we are really providing care for families that are low income. They can't afford, a center-based tuition. And so we're serving a very marginalized community, okay? So when the pandemic hit, it was devastating. It was devastating for the whole nation, but we in particular, a lot of providers were, of course, we all had to close our doors, but it just hit us in a different way. I would say funding resources and things like that, we had to find ways to still be able to pay our bills, keep our lights on, keep a roof over our head. And a lot of providers really did not qualify for a lot of the funding that was available for, essential workers and other people. And I would say, that even today, like a lot of providers that I know that are home-based, they were never able to reopen because they just really could not afford to reopen. They had to go and get jobs doing other things, although their heart and desire is to be able to provide the service to the marginalized community, families in our community. They just weren't able to sustain themselves and open after the pandemic. So it was really devastating, honestly, very devastating.
Yeah. And you all have been, the National Day Without Childcare, it's a decades long movement. And so you all have been fighting for these changes and fighting to be heard for forever. And it's really the pandemic that opened up that door. And for so long, the profession of an early childhood educator, you've been seen as, simply watching children or babysitting. But you have to go through quite a lot in order to be an early childhood educator. You have to do educational licensing. You have a certain amount of education, annual renewals. Tell us about the process you went through to become an early learning professional and some of those licensing requirements for opening up a childcare facility or a home-based facility. Let's start with you, Jillian.
Yeah, so again, as a home-based family child care provider, FCC or FFN, which I am, a family friend or neighbor provider, we do have to go through a very comprehensive background check that's going to, require, and that's going to include your fingerprints, sex offender registry check, complete basic health and safety certifications. And also we have to adhere to becoming active member of the Nevada registry. In order to stay in compliance, you have to make sure those things are done some of those classes have to be renewed on an annual basis, and some of them have to be renewed on maybe every 2 years. But we do follow a pretty, I think, strict list of things that have to be done. And in addition to that, when you are receiving subsidy, if you're going to take children that parents are on the subsidy program, the Urban League, they are also going to require a lot of paperwork to be completed. You're going to have a check, a home check, where they're going to come in and actually check your house to make sure it's a safe place. And as an FFM provider, you are required to keep a minimum of 2 children that are on the subsidy. So that's, a standard that has been set. And I think it's really important to point out, again, being a home-based provider, we don't have a lot of other means of supporting ourselves outside of what we're getting from the parents or from a subsidy program. So if there is, I don't want to jump ahead of you, but you know where I'm going with this.
No, go ahead, please.
We're very reliant.
What's unique to what you have to deal with?
Well, again, I just want to point out that we're serving a very marginalized demographic, okay? Parents that cannot afford the regular tuition of a center-based. So we're at the bottom, okay? And we're working with those parents the best that we can. So we're relying upon our state and county subsidy and federal government subsidy programs that's going to pay us, because we know these parents cannot afford to pay us. Okay, so if those programs don't come through, if they don't keep their word to us, we're pretty much on our own to figure out how we're going to pay our bills. And we're dealing with that right now at this very moment. We have been dealing with a situation with the subsidy program here in Clark County, the Urban League, where we were told we were going to be paid according to our contract. So when you sign up for the subsidy, there is a bit of a delay, okay, and we understand that. So according to our contract, they are, we're going to turn in our billing. We render the service first, and then we turn in billing after the service is rendered. They have from 1 to 30 days to actually reimburse us for the services that we've rendered. Okay. Now, in this particular case, we have gone beyond 30 days. We've gone approximately 11 days. Several providers. I can't even put a number out there because honestly, I don't know how many providers, but I'll just speak for the people that I've been in contact with. Over 50 providers have not received their payment on time, have been delayed past the 30 days, actually have gone into the 11th day, and we just received payment. And that was for the March billing. So I don't know anybody else in any other industry that would go 11 days, 30 plus 11. So that's 41 days past the time that you last received compensation for work that you've done.
It's the crisis is now. I think that solidifies that we are in the crisis. It's not impending. It's been going on for a long time. There are bureaucratic barriers to receiving access to these funds. But our child care providers are showing up every day, and they are not giving up, and they continue to provide this care because they know that there is a need and that families are depending on it. Sarah, same question for you.
Holly, you're so right. We're in it because we're passionate about it. And we know how now, since COVID, not only do we know how important it is, but I think the whole country knows how important it is. So we want our legislatures to come and, support us in that. Just a little, what Jillian said was super important. To give you the center perspective, or for all early childhood educators, we are required through the registry to do continuing education every single year. This doesn't happen while we're taking care of children. This happens on our own time, and we're not getting paid for that. And they're requiring hours and hours, 24 hours every single year of that. So it's things like that. It's these intangibles that we can't put, that are requirements for us, but that we can't put a dollar amount to. And I think that's huge. Again, very different than other industries where we're required to do something but not getting payment for it.
Frustrating, very frustrating. So just in consideration of time, I do want to talk about the situation with homeowners associations and the additional burdens that if you're trying to operate a home-based childcare, there's specific issues that occur in different communities that are governed by an HOA. So Jamel, tell us a little about that and what some of the solutions might be.
Absolutely, absolutely. We know that one of the most significant barriers to the expansion of home-based childcare is due to HOA regulations. And just as Jillian mentioned, this is a more affordable route for some of our parents. And some of our parents who have the youngest children prefer that more personal level of care in our home-based setting. This is an area we continue to work on to ensure that families have access to quality care in neighborhoods they know and trust, and to eliminate those barriers to regulations that prohibit a provider from operating a business in their home. And so while we understand the concerns homeowner associations may have, we believe that home-based childcare adds value with the additional resources within the reach of our parents who need it most, and provides the support and sense of community that keeps a neighborhood thriving. And so this is something that we will continue to advocate for.
Jillian, did you want to add anything to that? What's the experience on the ground for home-based providers and HOAs?
Yes, absolutely. I appreciate what you're saying right now, Jamel, because that really is what it's for us as a home-based provider. You know, we have to have a home in order to give the service that's needed in our community. And our parents do, again, I just have to keep reiterating, marginalized communities, okay? So there's a trust factor. A lot of families are not going to just take their children to strangers. They want to take their children to someone that they know, someone that looks like them. There has to be a connection, and we are the village in our community. So we have to have a house in order to be able to keep these babies and care for, the children in our communities. But if we're being put in a situation with these practices with the HOA, they're forbidding us to do a business in our home, that really affects us being able to serve our community in the way that it needs to be served. So that has to change.
Sarah, just one final question for the panel before we move to question and answer. And then Jamel's going to talk a little bit about our legislative priorities. But on the issue of wages specifically, Sarah, we know that, I talked earlier that an early childhood educator makes about half of a K through 12 teacher. What are how does that impact the workforce specifically and in your ability to operate your business? And what would you like to see change in the future?
So we actually operate at both a 5-star through the state, through the QRIS system, and also NACE accredited program. What that means to those that don't understand this is that it's a quality program. So there's indicators that we've gone through and continue to constantly update our quality on a continual annual basis. And that directly affects our staff, our workforce. And the reason is because there's things that are quality standards. For example, having staff come in for time before children come during the day and set up their classroom, clean up their classroom, have prep time away from children. Well, then what happens to those children? You need another staff member to come and cover. This all costs money. So it's these intangible costs that actually, while they support quality and we do see the difference in them, they do cost money. And so we're hoping that we can partner with the state, with different organizations to help kind of bridge that gap so that we can provide quality, but it's not on the backs of our programs.
Thank you. Thank you, Jillian and Sarah. This thank you for what you do for our communities. Thank you for being there. Thank you for telling your story publicly. Hang out with us for a moment, and we'll get some questions going from the audience. But Jamel, before we begin that, let's be positive here, right? We are in the crisis. We're in the midst of the crisis, but there are solutions. There are actions that we can take. There are actions that our decision makers can take. What is our agenda leading into the 2025 legislative session on the issue of childcare?
Thank you, Holly. Yes, the Children's Advocacy Alliance is working diligently to make sure that we're connecting with providers and community members, our state level agencies, to prioritize those policies that matter most to families and produce the best outcomes. And so our policy recommendations as it relates to childcare, we spoke about it earlier on with the state level investments in the general funds for the Child Care Development Fund to improve the wages and reimbursement rates and expand access to care. We know that Nevada is unique in many ways. However, we believe that in order to see the significant change that's needed, Nevada should follow some of the states that have moved to improve the child care system, like we mentioned earlier. In addition to those state general fund investments, we're looking at the importance of waiving those business licenses for new childcare providers, increasing accessibility through home-based childcare expansion, through eliminating those HOA regulations that we talked about that prohibit home-based providers from operating businesses in their homes. And then last but not least, alignment of the early childhood system to limit bureaucratic barriers to accessing subsidy and funds. So we know that early childhood does not function in just a silo. It is a systems level change that needs to occur to ensure that everyone is seen and heard, and that we have policies that are aligned with each entity to ensure that that system functions properly and funding is in the right places and makes it to the families and children that need it most. And so if you would like to get involved with us, if you would like to join this fight with us, please visit us at caanv.org. Thank you.
Wonderful. Okay, so if you have questions, again, pop them in the Q&A feature at the bottom of your screen. I'm going to give 30 seconds to see if we get some more questions coming in. Right now we have one question, which I'll go ahead and answer. So the question is, can you discuss what systems level infrastructure changes are needed in Nevada to improve access in addition to specific state general fund investments, particularly in regard to our ability to adhere to the new upcoming federal rule changes? This is a great question. I think maybe first, let's get a little granular in exactly what the rule changes are. Jamel talked a little bit about it. So what the Biden administration has done is, in this rule change on the issue of reducing cost to families, it limits the amount that families pay to 7% of their household income. So it's going to help alleviate the pressure there. It talks about expanding choice for families and making it easier for families to find childcare that meets their needs. So, some streamlining of systems, like Jamel was saying, increased payments to providers. It requires the states to make timely payments. We talked about that, right? So if we're already in a struggle for timely payments, what changes need to be made in the administration of these programs in order to comply with that rule? Honestly, and then it also talks about cutting the red tape. The rule streamlines processes to make it easier for families to apply for and receive child care assistance. So with those mandates, in a state that is already struggling to pay out funds to the entities that actually provide for reimbursements, we need to look at the structure of, my solution would be looking at the structure of the early childhood system as a whole, and what is causing those delays. I think there's several things that need to happen. We need to ensure that, state government is operating at the expected levels, that positions are filled and people are able to operate these programs and fund these programs. I think the streamlining of early childhood systems is crucial. Those would be my first initial thoughts. Does anybody else on our panel have any ideas for how the state will be able to comply with the new Biden rules? I think the general fund appropriation is crucial too, in order to, if we're expanding eligibility, by reducing the share that a family has to pay in order to receive subsidy, that of course opens up eligibility for more families. Right now, the national statistic is that only 1 in 7 eligible children are actually receiving subsidy. So we can open that up all we want, but actually providing access to that is in advertising and funding that subsidy. It's kind of pointless if we don't have the funds to be able to provide that level of care.
I just want to
Are there
add
any
that
other?
I just wanted to add something to what you're saying, Holly, as far as the state of Nevada. So we know that, childcare is not only, they make it like it's a choice, but it's an essential need, okay? Just like education. So early child education, which is childcare, and it's essential. And so our state should look at it as that. We shouldn't be looked at any different from a child going to grade school, K through 12th, okay? It has to change. These mindsets have to change. And we have to start putting the value in early childhood education from age 2 and beyond. And things just have to be adjusted, because there's no reason why this state is not, doesn't have a budget to provide care for children ages 2 and beyond. So I just don't understand why that is, but we need to change it. And we just can't just sit back and be quiet about it any longer. Like, parents need to make noise. We all need to be making noise, and employers should be making the loudest, because they need these employees to show up and go to work. If there's no childcare assistance for parents are not going to be able to afford to go to work, because they can't afford to pay for childcare to go to work. So there just has to be a shift in the way how we're looking at things. And we got to get caught up, because we know there's other states. You guys have given some great data today to show us there's other states that are already doing this. So come on, Nevada, get caught up.
Absolutely. Come on, Nevada. I'm, again, feeling hopeful. I think there's a lot of momentum, a lot of interest from the business community, but how do we best leverage that and all come together and make these things a reality? I am feeling very hopeful about the upcoming legislative session and all that we can accomplish. And it's because of folks like you. CAA is here to train providers and advocacy skills. We are so looking forward to the next few months where we're going to do just that. We'll be talking about our agenda on this issue and every other issue we work on in not just our early childhood space, but child welfare and children's health space. All of those things are combined and intersectional. So we look forward to the coming months leading up to 2025. I don't see any other questions. I'll pause just for a moment to see if any other questions come through. But if not, then we'll wrap up. Oh, we've got one. Okay. What role do employers play in helping to strengthen the childcare space? Can you provide examples of policies and supports they could implement? How do these look for different sectors, for-profit, nonprofit, government? Excellent question. I think Jillian talked a little bit about about this broadly, but Sarah Jamel, do you want to address the question?
Sure, absolutely. Again, we recognize that not every employer is able to provide childcare, but there is something every provider can do, whether it is providing the space for parents to have the time that they need to go and pick up and drop off, whether it's off-site childcare stipends. There is something every every employer can do. So I would suggest that you would visit the Children's Cabinet website, because they have excellent resources to allow employers to know how they can best support their employees and to keep them employed. And that longevity of employment, we know, is super important. And so thank you so much for posing that question. And I know, Sarah, your provider is doing some amazing things to support your teachers.
So, teachers can also have children that need childcare as well. So that's one of the most important things to us, is that priority for our staff to help them with childcare. Because ultimately we're also an employer. So it's just that circle, I think, that keeps going around. I think if we all make this a priority, it'll become much better for all of our families and children.
Thank you, everyone. Thank you to our panelists. Thank you to everyone who joined us today. This is being broadcast on Facebook Live and will also be on our YouTube channel. Please follow us, join our mailing list at caanv.org. We want as many people as possible to join this movement so we can make real change throughout the state of Nevada for our childcare providers. I encourage you to follow along on social media today with all of the A Day Without Childcare movements and events that are taking place in our nation's capital and across the country. Together, we can truly make a difference. Thank you so much, and we'll see you next time.